seems to just disappear a little bit, goes anteriorly, then more likely that is C6. Okay, and then come on to C7, the bump, if you like, and then that should roughly stay where it is. So if you're rotating, it doesn't really change, okay, around the C7. So in this case, probably life is a little easier, yeah, trying to palpate that one. The spine of the scapula, is it going to be in line with where, roughly? Spine, scapula, T3. And then the inferior angle of the scapula, T7. Yeah, so you can almost roughly work out where things are, yeah, by finding one landmark, yeah, the second landmark, and the third landmark. Yeah, so you're not going to be far off. Yeah, you might be one segment out, but you're going to be close. Now, if I flex my patient's head, so we're going to go with C7 on this one. So if I look at, say, C7 and I look at T1, then if I drop down onto the T2, and I try to find where T3 is, yeah, so I can almost feel the spinous process is on each one, and I can also feel the dip in between. So the dip in between will be known as the interspine. And then when we are palpating, whether you are palpating over the t-shirt or over the skin, so find a vertebra and go to the next vertebra and go in between. So your finger is lightly in between the space. And then what I'm going to do is flex and extend motion to see whether that vertebra is happy to open or happy to close. So there's not much movement in here, even though it looks like there is here. But when I'm palpating, I don't really, let's say we start here in neutral, and then I flex, I don't really feel much motion of C7 on T1. So if I go, say, to T1 and T2, and I do the same movement, I feel a bit more movement now. So it's comparative. So they use, in osteopathy, they use the word the quality and the quantity of motion. But basically what you're feeling for is, do you feel movement or not? Yeah, and you are comparing the one below, and if you can, you're palpating the one above. So the ones below seem to work okay, but C7, T1 feels a bit restricted in flexion. So if it's restricted in flexion, it doesn't mean it means it doesn't want to open, so it must be fixed, closed. Yeah, okay, so it's either going to be closed on the left or maybe on the right. It can be fixated closed at both. Yeah, but you might find if you find a shallow, deep side, then obviously the shallow side is the side is fixed closed. Okay, so far. So that's all I've done. I've assessed for the number, if you like. So I think, well, let's go to C7. I think, okay, let's see. Yeah, so C6 seems to disappear. So I know where T1 is in here and T2. Yeah, the inferior angle is T7. So then I'm going to then find the interspine. Remember, if you're doing it 5-10 times, it'll feel a little easier, because this is passive mobilizations. So you're already treating without realizing you were treating, okay? And it's quite therapeutic for the patient because you were doing the motion. Now, let's say, for instance, I believe C7 is restricted on T1. Now from here, if you think about my picture, I want to put my thumbs onto a level. Like my picture, thumbs would be like this, but it's awkward. So I tend to be more sideways, yeah, more horizontal rather than vertical. Yeah, you'll see why in a second. Yeah. So if you find the C7 and T1, so you roughly think about what level we're on, okay, in here, and then find the level that's restricted and come directly across. If we started with a patient in flexion, that might give you a key movement, okay? So if I bring my thumbs about an inch or so lateral, like my right thumb goes in a little further, but my left thumb comes back. So if my right thumb goes in deep and my left thumb stays shallow, what do you think, Sarah?
Close on the left.
Close on the left. Well done. People understand that or not? Yes, no? If you don't, speak up. So the idea is that in a simplistic way, if your neck is in flexion and there is a shallow side in flexion, then that side will be fixed closed. And if I was to do the same movement in neutral or extension, then hopefully, if my thumbs are in exactly the same place, would be more level. And then when my patient goes into flexion as far as you can, yeah, as long as you're in the same place. Right side deeper, left side shallow. Come back up, please. all the way, but maybe a bit more into extension, and then they seem to be equal now. Okay, it's an equal level.
Are you actually putting your thumbs on the level of the vertebrae or the space between the vertebrae?
Well, it depends what level we are on, because it changes a little bit. If we're on with that 1, 2, 3, 4, 5, 6, 7. So if I'm on, say 7, yeah, and like T1, if you are palpating further down, T1, you can actually be on the level. Okay, so spinous process of T1, it's going to be adjacent to the transverse process of, okay? And the same for T2 and T3. But when you come in below, it changes a little bit down here. They call it the rule of threes, okay? But I wouldn't worry about it too much. But for the demonstration, I showed you, so if I, let's say that's 7 in T1, yeah? So if I'm in that space, if you're looking at this one, you might look at that I'm actually on T1, okay? Yeah. So if you found C7, and you come adjacent to that, and your thumb is going to be about an inch lateral, okay, over here, okay, but the pad of the thumb is going to contact further area. You're not going to be directly on what you think. It's an awareness for the position, all right, because you're not going to be on the TP, you're not going to be on the facet joint. It's an awareness of roughly where it will be, yeah, okay. But in, you know, for the demonstration, it doesn't really matter where I was placing them, but if you want to be specific, I would try to be, if you're going to be on the first 3 vertebra, try to be directly adjacent to the spinous process. Yeah, and then T3 will change a little bit. Yeah, but I can explain that as we go through.